see you. Yeah, let me borrow that. Okay, thank you. We're making a documentary, essentially, sort of telling the story of people who are in chronic pain and people who have PTSD, et cetera, and hoping to see if we can make a difference in our culture about getting people the pain relief that they need. So, you're here for renewal, so cannabis is working for you.
Yes.
Tell me your story.
I've got degenerative disc disease, and 4 of my 5 lumbar discs are pretty much shot. And so the spinal cord is being pinched and causing constant pain.
And how does cannabis help you?
Well, the CBD helps the pain, and the THC helps me sleep. So
There you go.
yeah,
So pain is a terrorist.
yeah,
Lack of sleep terrorizes us.
Yeah.
So you're getting better sleep and some pain relief, which makes life livable.
right.
Okay.
Yeah, and I'm off the opioids. I was on oxycodone for 3 or 4 years. So I'm glad I didn't get addicted to that.
Yeah, let's talk about that. So there's addiction, and then there's dependence.
Uh-huh.
Now the whole culture is going wild over this concern that oxycodone is causing addiction. Well, does alcohol cause alcoholism?
Yeah,
It's kind of necessary,
Yeah.
but it's not the causative agent. It's genetic, it's cultural. There's a whole lot of things
Yeah.
contributing to that. But using a medicine for your pain is not necessarily addiction. It may be dependence. And
Yeah.
dependence means your body's used to it.
right.
Addiction means it's causing harm
Yeah.
and loss of jobs or relationships or any other problem. You didn't have any of that, did you?
No.
So no addiction problem.
No.
And frankly, addiction is rare in the chronic pain patient who's in our age group. If you're born before 1980, your likelihood of developing addiction at this stage of life is practically zero. Addiction shows up when people are in their 20s and 30s. So we're overreacting to the
Yeah.
whole heroin epidemic, but unfortunately we have to get people off opiates because they're taking it all away, right?
Yeah, the bad thing is the insurance will pay for the opioids, but they won't pay for the marijuana.
Exactly. What a conundrum, right?
Yeah, yeah.
Yeah.
So someday it'll be legal, I hope, and people will be able to get access to it.
Yeah, so my point of view on that is like, okay, if you're, what is the total cost? So yes, your oxycodone might be paid for by Medicare, and the cannabis isn't. But there's co-pays, there's travel to the doctor, you have to see the doctor every month, you have to
Yeah.
pee in the cup and all that kind of stuff. Those are all extra costs, plus the cost of feeling like you don't
Oh, yeah.
want to be an addict or the
Yeah.
shame involved in that. Did you experience any of that?
Any?
Any shaming from your doctor that you were on an opiate or
No,
anything
no,
like that?
she was
Good.
very nice.
Okay.
She was. I told her I was going to try the medical marijuana, and she was all for it.
Good.
Yeah,
Okay, so your choice was to come off the oxycodone yourself. It wasn't
Yeah.
taken away from you.
yeah, right.
Powerful when someone chooses to come off an opiate.
Yeah.
They're usually successful in doing
Yeah.
that. Okay. Now, tell me about your T-shirt. I see trees of green, red
Right.
roses too.
Louis Armstrong.
I see them bloom for me and you, and I think to myself, what a wonderful world. Well, if you're sleeping and getting pain relief, then you got a wonderful world.
Yeah.
Can't wear that T-shirt if
Yeah.
you're miserable,
Well,
right?
yeah. Well, constant pain can really get you. Get depression, and it's hard to live with when you can't do anything. Your wife's got to do everything for you and stuff like that.
That's terrible for a man's
Yeah.
self-image and
Yeah.
self-esteem and all that stuff, right?
Yeah.
So you carried mail for how many years?
40.
40 years. Thank you for bringing the mail through cold and snow
Yeah.
and dark of night and, may I say, fucking pain. You delivered for us.
Yeah.
So thank you.
Retired, and then all the body parts started falling apart. So. Yeah, I do Santa Claus.
Do you?
Yeah.
Okay.
If you got the beard in the belly, you might as well go for it.
Okay, so I'm going to give you my Christmas wish.
Yeah.
I wish every doctor could follow their Hippocratic oath and do the right thing for the patient that's in front of them.
Yeah.
Whether it's cannabis or kratom or oxycodone or whatever it is people need, and that we could stand by our patients again. Can you make that happen for me, Santa?
I wish.
Okay. All right, my friend, you are renewed for another year. Any questions for me?
Nope.
Thank you, my friend. Another year. We're gonna scan these documents and then give them right back to you.
Okay.
All right, come on out. Thank you. And he's got a couple pages in there that he handed over to. Take care, Mike.